Well, today on the program, my guest was a seasoned public servant with decades of experience in healthcare management, administration, and policy. She is a professor of pediatrics, and of course, to the big one, former minister of health. In fact, the first female minister, and she still remains the only female minister, of health in Nigeria. Yes, she'll be joining us today to talk about, her experience. We'll talk about the healthcare system, the past, the present, and the future. And I'm talking about Professor Adenike Grange. You're welcome to the show.
Thank you very much.
Yeah, glad to have you on the program. But very quickly, let's get to see her profile in full. Once we come back, of course, the interview segment begins. So that was the profile of my guest today, Professor Adenike Grange, and yes, you've seen it all, from it, a professor of pediatrics, University of Lagos, a seasoned public, servant, former Minister of Health. She served 2007 to 2008. So you're welcome to the program once again.
Thank you very much.
You served as the minister from 2007 2008. Do you feel maybe if you had more years, you would have laid the proper foundation for the Nigerian healthcare system?
Okay. Again, I thank God for making it possible for me to have that experience. I never, for the life of me, think that I would become a minister. But, out of the blues, I was asked to come and be a minister. And I felt...
But sorry to butt in, do you think someone recommended you?
Yes, somebody recommended me. The professional, one of my professional colleagues recommended me. So I was not part of the political system. So I was recommended because these professionals wanted something different for Nigeria. They knew that we had the capacity to build the Nigerian health care services, along the same lines as abroad. So, they came out and recommended me, and at first I was a bit reluctant. I said, well, look, this meant a lot of time away from my home, but then I thought, well, if I didn't do it, I would have no justification for accusing government of not giving us the opportunity or the capacity to do something about healthcare. So it was on that basis that I took up the position. And again, I felt that it was something that I could excel in because of my past, because I had the knowledge, I had the skills, and I had the network with international agencies. So I knew that if I was given the opportunity and the wherewithal to do this, it would work. However, I was in a political arena, which unfortunately became prioritized as the political gains were prioritized and not the gains that we wanted to give the people health-wise. So anyway, I don't know whether we have not jumped the gun by going straight to this to this other experience, because there were other experiences prior to that, which I thought that had prepared me for
the office. But in hindsight now, do you regret taking that offer, or you wish maybe if you had rejected and perhaps could have come in future, given the short stints you had as minister and the controversy that ensued?
That ensued. Yes, it's very difficult to say what could have happened. But what I felt when I was asked was that, this was probably the time that God chose for me to go in there. And I went there with an open mind and a lot of a lot of passion to make things work. I even devised plans of getting support, advisory support in a different way from those who had gone before me. And that was working. It was working until, the fiasco in the ministry. So I believe that I learned lessons. And the lessons I have learned, I have put them in my book, which is, In Pursuit of Excellence, Truth and Justice. And just to help others who are coming behind me, who have the same kind of orientation, the same kind of personality, because that's just do with personality. And so, I put that in my book. And hopefully there will be another opportunity for maybe my granddaughter to follow.
Okay. Before I leave that, I will talk more about the healthcare system, because I recall the interview you had then. After meeting President from late President Yaradua, and you said you will take responsibility, but you won't take the blame, for it. Till now, many Nigerians are still wondering what happened. Perhaps maybe shortly may want to say the untold truth behind the resignation or even behind that fiasco.
I don't like to discuss in detail what happened, because it will mean mentioning names. I don't want to mention names because it has happened, and even some of the names that I would have mentioned are gone. So what happened actually has to do with the culture of the ministry. The ministry, the accountability framework for the ministry was built not with the minister as the head, but the permanent secretary as the head. And that created a lot of problems. Because, there were two ministers, and all it took was for the other minister to get on better with the permanent secretary. And things would not work for me, That was exactly what happened, The structure was not right. And there was no way I could get somebody to make it right, because they all had political intent.
And you were a technocrat.
I was a technocrat, They all had political intent. And I just felt that, look, if you cannot entertain improvement within the political setup, without bringing in the technical detail, the technical expertise that I have, and I was ready to use my technical expertise. And I will tell you that it was a mystery to those I was networking with internationally. It was such a mystery that they sent envoys to Nigeria to come and find out what happened, because they had thought that with my expertise and connections, etc., such a thing would not happen, and that I would be my own plans and programs will be accepted, and there'll be empowerment to carry them out. So, because it was not a question of money, the money was there to carry out them. It was a question of identifying priorities, making them put money into prioritized programs. That's all. And one of the programs that I suggested, which eventually was now prioritized, was the money, the funding of the basic healthcare services and primary care. And it virtually was, I would say that it was virtually the contention that actually got me out, because I had to contend with the legislature and the executives about, why we needed the money and what we needed to do to get the money, etc. So that was one of the problems that we had.
Okay, well, every cabinet has a composition of technocrats and politicians. So what advice will you give to technocrats?
Unfortunately, there are very few of them now, technocrats in governance. The whole governance has been taken over.
Well, at least the current Minister of Health, Professor Ali Pati, seems to me like a technocrat, because yes, he was a medical doctor, and he was not known to be a seasoned politician. And even checking the Ministry of Health, I think we've had more technocrats than politicians, because no president will want to joke with the Ministry of Health. You don't want to put a core politician in that ministry. Like somebody, politician who was a medical doctor. And looking at the whole list, I think we've had like 10 ministers, including the current minister. The only one that didn't study medicine will be your predecessor, Professor Iyitayo Lambo.
Did very well, by the way.
Exactly.
Yes. You mentioned my colleague, Professor Pati. I would say that he's even better equipped, not just technically, but politically. So, I don't want to go there. I think he can vouch for himself. He knows what he's doing and how he can make things work. You see, again, the political landscape has changed, and it keeps changing every day. So it's not something, you cannot have a prescription, a one-time prescription for any minister. The minister has to continue to study, what is going on around, and adapting, his attitudes or her attitudes to various incidents that occur. But I think the main thing is to equip the minister with the authority to do things. With Professor Pati, for example, he's Minister of State. He's a junior doctor to him. So, to all intents and purposes, he is the head. When I was minister, my Minister of State was an architect. He was about the same age as me, and had a professional clout in his own profession, and also was a politician. So, there's no comparison with our situations. So you need to look at the various situations too.
Okay, now, the current state of healthcare system, is it better now or worse off?
When you look at our indicators, because the impact indicators are what speak for us, I would say that it's not better. These are impact indicators. Process indicators, that is, how are we getting the states to do what they should do in terms of healthcare? Because, as you know, health is on the concurrent list. The federal has its own, yes, its own responsibility, state responsibility, then local government, they have their own responsibility. And one of the problems is the lack of coordination. I try to get some coordination, and I think I was succeeding gradually. But thank God that the local government has now is now being given their own resources to be able to deal with their problems, including health problems. So that is going to help to change things positively. I'm talking of process indicators now, So that but it's taking too long. It's taking a long time, and wherever the politicians are supposed to fund health, they need to fund it in a way to improve the health indicators. Most times, they don't even look at the indicators. The indicators of how many children, how many mothers have access to effective and prompt healthcare delivery. That is one indicator that they need to look at all the time. And it should also be, the result should be clearly stated, because this is a way of showing that they are accountable, for these things. So there must be results that the citizens also are looking at and feeling that, yes, they are getting value for money.
Well, Professor, the Ministry of Health has never been lack of expertise or experts. In fact, we've had 6 professors, Professor Lambo, you yourself, Professor Adenike Grange, Professor Babatunde Oshotimeyin, Professor Onyebuchi Chukwu, Professor Isaac Adewale, then currently Professor Ali Pate, experts in healthcare system. So why is this? We've not seen the desired results. What's happening?
Okay. All ministers are basically responsible for policies, for bringing out policies, plans, strategies and plans.
But all this should drive development. There are policies you formulate.
We have policies. That's where I was going. We have come up with all the various policies that are needed. We have the National Health Act. We have so many that, if they were implemented, would make a difference to the health status of people. The final indicator, apart from maternal mortality, is the life expectancy.
Yeah,
the life expectancy of people has been very little over the years. Life expectancy depends not only on hospital services, etc., but mainly on, let's say, nutrition, food and nutrition, jobs, various things that you and I need, basic life support. That's what So in the middle of it all, we now have insecurity problems, which have taken the lives of so many people. Those lives are part of the ones that will need to be added to low life expectancy.
Okay.
Yes.
Okay. Yeah. There's something you said I do not understand. You said ministers, make policies and not implementation.
We make policies. We are supposed to also get the executives to make budgets budgetary allocations that will help for the implementation of those policies. You know. So, and as I told you, health is on the concurrent list. We have 36 states that they also get budgets for healthcare. But, you know, because they are so fragmented, all that, nobody is actually following up on what they are doing with the budgets, the healthcare budgets at that level.
At the state level.
Yeah, at the state level.
But people will also be interested in, okay, what are we also doing with the budget at the federal level? For example, we have federal medical centers almost in every state.
Yes.
One of our foremost, medical centers would be University College Hospital, in Ibadan.
Yes.
So these are frontline, medical centers. So what has become the ones the federal government, the ones that are under the federal government?
Again, I think we are somewhat over-ambitious in creating institutions, hospitals, teaching hospitals in particular, and federal medical centers. The reason being that the funding of those hospitals is enormous. It is, the total funds that are available for, development of Nigeria cannot fund all those hospitals. This is it. So it's unfortunate that in creating those institutions, the adequate provision, adequate thoughts are not given to how to get the funding. It's not just government that will fund this. You have to have private sector as well. And also there will be external funding. But they must, but they must all be put together and expended judiciously and creatively. You see, what we always thought, I thought, in fact, at that time that I was there, that what we needed the states to look after their state hospitals, and that's for secondary care.
Yes.
Well, the local government to look after the primary care. States to look after secondary care. Then when it came to tertiary care, we will have a good number of institutions that will be training in general care, general medical care, a bit of specialty, but we need to have at least one subspecialty care hospital per zone to give the specialty care, because that is the most expensive type of care that you can have. What has happened is that they are thinking that all teaching hospitals should be able to give that care. They cannot. The money that they get is not enough for that. But we had thought, and I followed the thinking of Professor Oliko Ransom Kuti, when he was minister, that we needed subspecialty hospitals, one per zone, so that, let's say that oncology, that is anything at all in treating, managing oncology, etc., you have it in one zone. Anything at all in managing orthopedic problems and all that, you have it in another zone. And so on and so forth. There are subspecialties. And then the emergency care. Emergency care needs to be well looked after in all these teaching hospitals. And that is the most expensive part of their work. But it's not well resourced, unfortunately, because again, it falls into the general care arena. Everybody thinks that, okay, when they get to teaching hospital, they should be seen for their eyes, what is it? maybe a little lump here and there, and you know, that's not what teaching hospitals are for. Teaching hospitals, if we can even just set up teaching hospitals to deal with emergencies properly, things will work better for
Okay.
us.
But now, like you did talk about the 3 levels of healthcare: the primary, secondary, and tertiary. The primary healthcare is in the hands of the local governments, and can we really trust? Because in all of this, I would say the primary healthcare is so vital, because that's where we have, you know, we talk about mortality rates, neonatal mortality rates, you know, infant mortality rates. We deal with children, maternal care, and all of that. But can we really entrust this in the hands of the local government? We have 774 local government areas. How do we monitor them? How do we ensure that they are doing the right thing with primary health care?
That's a very good question. Primary health care is not meant to be on its own. It is meant to start management of healthcare at the grassroots, but it should have supervision from the state level, from the teaching hospital level, and they should also be able to refer cases if they cannot deal with to those areas. This is a kind of operational system that is not working. If it were working, it will be, you know, you will get a different outcome, get a better outcome. The fact that the local government is now given that authority just to look after primary health care without even referring to the secondary care services to states, that is not going to work. The states must also support, they must give supportive supervision to the primary care level. And, you know, it has to be, otherwise it's not going to work. And you see, the local governments, they are hamstrung by the fact that they don't have infrastructures. They don't have good clean water. They don't have electricity. They don't have, you know, so many things. And yet we say that people should go there to, you know, if primary health care was working well, they should be able to have deliveries. That is normal deliveries there. If the deliveries are getting complicated, there should be a way of evacuating them immediately to secondary sites. When I was minister, I visited a primary health care facility in Yaradwas. Where does it come from? In the north, you know. So I visited that, and there was, you know, what should have been done was done correctly. At that primary healthcare site, there was an ambulance there, ready to evacuate patients whom they could not deal with. That is the type of primary healthcare that we're talking about. Not just, you know, leaving the people to find their way to other places.
But perhaps we should even rethink that, because now that some local governments in some states are underfunded, so how would they take care of the primary health care? So should there be a rethinking regarding that? And from the look of things, even the tertiary, you know, healthcare system is not, you know, properly funded. Secondary too, not properly funded. So, because if the tertiary is properly funded, then they cannot. Because I even know that some federal medical centers have, you know, affiliates, you know, in rural areas which they oversee. So, but if they are properly funded, they can actually monitor and ensure they also equip, you know, these hospitals in rural areas.
Yeah, there's one thing with funding. You may have the funds, but you have to prioritize the way you use the funds. And that means that you must have well-trained managers and financial officers who know how to manage funds. You know, it's not enough to just say that you are getting doctors and nurses into the primary care. You must have seasoned administrators who also are they're patriotic, because they could be seasoned and not they're not patriotic.
Well, patriotism is relative. It's not written on the forehead. So I could think, Mr. A is patriotic, but he may have another agenda. So how can we even detect patriotism? That's the problem.
You can detect patriotism.
When you look at track records.
You can, yes, look at track records, but you have rules and regulations. They must be able to obey the rules and regulations. They must be accountable for certain things that have been put under their care. You know, that is how you measure patriotism: accountability and adherence to the rule of law. You know. So, unfortunately, it is not happening in many institutions. This is the problem, and it is the only way we can change things, turn things around. To look at our units, various units, are they actually following the rules and regulations in that unit? Are they accountable for the responsibilities they have been given and the funds they have been given to carry out these responsibilities? I'm afraid it has to be at the various unit levels. You know, that's the only way I see it.
Well, interestingly, you are a professor of pediatrics.
Yes.
And the stats are so worrying, because I have the under 5 mortality rate, 110 deaths per 1,000 live births. That's roughly 1 in 9 children dies before age 5. And the neonatal mortality rate, that's the first 28 days, about 41 deaths per 1,000 live births. Then infant mortality, that's from I think 0 to 1 year, according to Nigerian Demographic Health Survey. And so everything, it doesn't even look good. It doesn't look good at all. And that points to our primary healthcare. As a former minister, what are you doing within your own authority? I want to believe that maybe there's an association of former ministers. There's an association, yes, for ministers of health, I don't know, or maybe there's an association of professor of pediatrics, medicine and surgery and all of that. Is there anything you are doing? Is this also as worrying as worrisome to me?
Yes, I have not resigned from becoming involved, engaged in healthcare service delivery. I cannot wash my hands off it, because I know that not only is it an indicator of development, it is an indicator of development, and it's also something that, unfortunately, if not put into check, if not done properly, we will continue to slide downwards, because people will continue to go abroad for healthcare services, and this the institutions.
There's medical tourism.
Exactly.
People go abroad these days. Those that have the wherewithal, they rather go abroad, even for ailments that can be treated here in Nigeria. Is there an advisory council, or should we be talking about an advisory council now, which will be made up of maybe former ministers, professors? I mean, is that in the offing?
I wouldn't know. I mean, that we would have to ask the current minister. But what I know is that, as you have suggested, there should be a council that is composed of those who had had the experience and who know what they think should be done to make corrections in the system. For example, I know that you cannot expect doctors to be working in rural areas when you don't give them accommodation. Doctors and nurses. If there's no accommodation there that makes them comfortable, how can you get them to work in? No, why should they? Yeah, the people who are sending them there are in Abuja in their comfortable abode with electricity and all that, and then they want the doctors to go. No, cannot be. We must also pay attention to the environment of, working environment of our healthcare professionals. That includes nurses, it includes even administrators who go there, It's not only doctors and nurses that are needed in those health units. You need radiographers, you need laboratory assistants, you need, all those people. Yeah. They must be looked after, So that's why I'm telling you that this thing has to be taken unit by unit. And that is where it is important to let the local government know what their responsibilities are. Let the state know what their responsibilities are, and the federal. And then you have to now monitor them, evaluate them. Yearly, there must be yearly reports from the various groups. This is what we did to facilitate the correct management of healthcare, effective management of healthcare. That's what's happening abroad. That's why things are working. We seem to think that once you have a perfect technical person in charge of healthcare, everything is okay. No. We must think seriously about everything that goes with healthcare.
Okay, now I need your take on something, and that's medical negligence. It has been a big problem now, particularly with what happened to the legendary author Chimamanda Adichie, and I think that's pushed our healthcare system to the whole world. She talking about how the son was maltreated, the misuse of propofol. I hope I got that name right. So I've interviewed doctors, and some would say, well, at times this negligence comes from the stress they face. For example, a doctor seeing up to 30, 40 patients per day, and one even told me that there was a day he almost misdiagnosed a patient. He was tired. So the diagnosis, he gave her the diagnosis of the former patient. It was when they got to the pharmacist that the pharmacist saw that and like, no, this can't be for you. So where do we go from here? And some also feel there's this impression that medical professionals, medical administrators, they cover up even when doctors make mistakes.
It's very unfortunate what happened. And my heart goes to Chimamanda and her family. But we could have predicted that kind of thing would happen. Seeing the state of our healthcare delivery. Why did she have to go to a private hospital if we had a working teaching hospital? That is the question that is in my mind.
But some people want exclusive treatments. The general hospitals are so...
This is what I'm saying. This is what I'm saying. That, you know, a very responsible government must make sure that at least some of its institutions can deal with that kind of emergency, you know. And, you know, because it is much more expensive for private hospitals to deal with those emergencies, to have, you know, MRI and things like that, and, you know, they just spend their money on the equipment, but the training may be a bit faulty, you know. And whereas in the teaching hospital, we will pay attention to everything: training, accountability, and because the way we train doctors we demand accountability from them. Otherwise, they cannot pass, you know, any training in the teaching hospitals. So that is what I think. That is unfortunate that today we do not have a reliable system that can guarantee life, that can guarantee survival under emergencies which normally could be dealt with in that setting, you know, if they were fun, if they had all the things going for them. So they've gone to the private hospital, and incidentally, I don't know a lot about what happened, but apparently they were somewhere else before and they were referred to this other hospital and all that. All that causing delay in management, and a lot of problems come with the, you know, all the things that go around getting access to the right institution, access to the right form of therapy. You know, take the road traffic accident, for example. There's a road traffic accident. There is no first responders, no ambulance, no nothing, you know. And eventually, the patient is taken to the hospital in extremis, almost dead. What can that hospital do for them, you know? So I'm saying this because it's not always the fault of what the hospital people are doing that cause the problem, that cause the fatality. It is something that's built up from the beginning. Something that could have been done at first was not done. That's my impression. Even with that child, you know, at first, the first person to see the child, I don't know what diagnosis.
But what about the accusation that medical professionals tend to cover up, you know, these cases, like a protection to doctors when they are negligent, when they make mistakes? Because that case came to limelight because it was Chimamanda Adichie. Yes. It could have happened to a common man.
Yes, you see, it is difficult to prove negligence when you have not got all the facts. You know, all the facts in a formal setting and all that. Obviously, if you are my child, I would be very emotional about it, and I would go out and accuse and all that. You know. What I don't know is all the facts. I don't know. But the fact that if it is true that the doctor was negligent, of course there should not be cover-up. But we still have to find out, is it true that the doctor was negligent? There are ways and means, and I hope that they're investigating thoroughly to find out, because we cannot allow that kind of thing to happen and not deal with it appropriately. More like that will continue to happen. So this is the problem. I believe sincerely that where the doctor has been proven to be negligent.
Yeah, well, like you said, it's hard to actually prove negligence.
It's possible.
It's a long process.
Yes, it can be done.
And the outcome, most times, Nigerians don't even know the outcome. Like in this current case of Adenike, I doubt it if we ever know the outcome. You know, maybe settlement will just come at some place, because I've heard of other cases. You
won't be so pessimistic about it. You will know the outcome. You will, because this is something that it is very important for the system not to take the wrong side. Because then we cannot improve. We can't improve,
Okay. So 2020 was almost all about COVID, where our healthcare system was exposed. And did we learn lessons, from COVID? Because 6 years after, there are complaints. Did we really learn the lesson we should learn from that encounter?
We should have learned from COVID. We should have learned that if we are not prepared for emergencies, if we are not prepared for epidemics, we would all die. We all stood, we are all really supposed to have died because of our situation in Nigeria. But somehow,
some say it was by providence.
Exactly.
Do you believe in such providence?
What
the projection day was
what do we call providence?
Like divine intervention.
Yes, divine intervention to bring us vaccine at the right time.
How many people even received the vaccine?
And those who did not receive, unfortunately, died. That's the thing,
But many Nigerians that are still living did not receive the vaccine.
Yes, because they did not come in contact with it.
And because some also were skeptical about.
This is it. It was a primitive situation for us. We didn't know what was happening. We didn't have the tools. We didn't have the medicines. We didn't have anything. As you said, it was one of those things that just had to happen. Take, for instance, in the Middle Ages, the epidemics that they had. That it was just providence that made some people survive, and that was the situation which we were.
Okay. So now, what is the biggest problem confronting our healthcare system? Is it funding or leadership?
It's both. It's both funding and leadership. I say it's both because when you say leadership, you only look at one level of leadership. You have to look at several levels of leadership. Right down to the minutiae, to the little village. There is leadership there. If they are not working properly, things will not work. So it is both. That's what I think. I know you were expecting me to give you the panacea to say,
we will definitely come to that, because now we've identified a problem.
Yes.
And we cannot end this program without you coming up with a solution. So what's the silver bullet? Yes.
The silver bullet. The silver bullet is to make sure that we elect into leadership positions those who will take seriously the need to preserve human life, the need to preserve human life, and to be ready to spend anything to preserve human life. That is it. That is it. If you don't have Leaders who are ready to do that, to think of human life as a priority. Human life are prioritized, and where they are not able to fund everything, they bring up insurance. If you don't have the money to pay out of pocket, just pay a little at a time, insurance, and you are guaranteed.
But we do have that. There is, a national health insurance. Some states have. Then we also have insurance companies that do health insurance.
That's why I told you that you have to look at the leadership at every step, every place, every institution. We have insurance system, but who are the leaders? Who are those leading the insurance system? What are they doing? How do we get any reports from them?
Yeah. Well, let's end this interview with a bang. And what policy? You did talk about leadership the other time, but in terms of policy, what's that key policy you think the Ministry of Health should implement that can, at least to an extent, turn things around?
There is no policy that the Ministry of Health can implement that will turn things around without the support of other institutions, other infrastructural institutions. They cannot do it on their own. They must get the support. They must get support of education. They must get the support of water, electricity, water, all those must work properly. Without them working properly, the Ministry of Education and the Ministry of Health can only do its own little bit. And they continue to do that. And it continues to make a little dent, but it cannot turn things around.
Well, we hope one day Minister will definitely have enough. We hope one day the Grange healthcare system will be well funded, and also in terms of leadership, there will be that political will to turn things around. Many thanks, Professor Adenike Grange. Like you did say behind the scene, though you are retired, but you are still very active. I know you go to meetings here and there, and recently we were in Abeokuta for a meeting, I think, among pediatricians, where you were one of the keynote speakers. So we say best of luck in what you do. We enjoy your expertise, and we pray for, yes, long life and in good health, of course. Thank you so much for allowing us into your home. So thank you very much.
Thank you so much for giving me this opportunity. I'm very passionate about what you have asked me about. Really, I feel that Nigeria can be in a higher position, health-wise, education-wise. You mention it. Economically, everything. Nigeria has it all.
Thank you so much. On that note, we draw the curtain on today's edition of Hot Seats. So till next week, when we come your way again, I say to you,